sidetracked by a very unusual finding. There were several patients that came with to do the biopsy study, an affected and an unaffected patient. And it's like 3 or 4 of them in a row, you actually found that the unaffected relative actually had the mutation that caused FSH. And they had no muscle weakness, and they really didn't identify themselves as having the disease at all. And so these photographs are actually two of these patients. And so they presented as the controls, but their genetic testing came back positive, and you can actually see they actually have quite good facial strength. And so there had been a lot of reports that there were people that were non-manifesting carriers of FSH, and there was a lot of debate about what that really represented. Is it true that they really just don't have FSH? Or is it possible that there's that along the spectrum of disease that they are so mildly affected that they never show up to a doctor's office, and so we never identify them? And I'm sure, I don't really, it seems fairly obvious why that would be important, because what that implies is having the genetic mutation does not necessarily imply that there is severe muscle weakness. There is some other factor going on that modifies the presentation of FSH. And we're really become very, very interested in determining why that is. And it is possible that there is a major modifier of disease. The way that I like to explain it is that, well, maybe this deletion in chromosome 4 is the on-off switch, but somewhere else in their genome, there's a volume dial that will tune up and down and make the disease milder or more severe. So we actually did biopsy this patient and MRI on these non-manifesting patients. And in this case, actually, the muscle actually does look, you'll have to trust me on this one, the muscle actually does look very good. And the MRI also looks very, very normal. And this has become a major new project for the FSH Wellstone. We would like to start identifying more and more of these very, very mildly affected or unaffected people who carry the mutation. Because we found 2 just in our study. There are probably more out there. We didn't find just the only 2 in the world. And so one thing I would like to ask of my audience is if you actually have relatives who are at risk and are unaffected, to contact us. We'd be interested in actually doing genetic testing and potentially finding more of the non-manifesting group. And I will put our contact information further at the very, very end. Okay? And we want to scan them, of course. We think it's very likely. Yes.
We do have a couple of questions coming in from the stream. Do you want me to wait till the end? Or?
Yeah. Well, it's not going to be too much longer. I think I would really like to wait till the end if I can. All right. Thanks. So we think that it's very likely that MRI is going to be able to detect changes that regular strength testing cannot. And this is actually one of our patients who was in my MRI study. And he actually did not have any weakness in his legs at all. We measured this and no detectable weakness. But what you can start to see, though, is on MRI, there is starting to be abnormal fat infiltration in just this muscle and just that muscle. And this is only one of the 4 hamstrings, and so the other 3 look fantastic. And so there is no real detectable weakness on this examination. And so at this point, we sort of had to, we decided to kind of take a pause and think about it, because our MRI protocol is, I think, we'll look at very large regions of muscle when we know that the legs are affected, and it gives us a very good sampling of affected versus non-affected muscle. It may not be sufficient enough scanning just of the legs to prove that there are people who have no disease at all. And so we have to think a little bit out of the box, and so we're now in the process of expanding our protocol to include whole body MRI. And this is actually a relatively recent development, and that's for several reasons. In order to scan very large areas of the body, it takes a long time. Basically, you know what you need to. It is just really long. In order to get good, in order to decrease the time, you usually have to give up some of the higher resolution on your scan. But with some of the new scanners, there are groups who say that they can get the whole body MRI scan down to as little as 30 minutes, which I think is actually really fast. And I'm not sure if this is something that we would be able to do in our population, but certainly that would be really feasible in order to get a whole body MRI scan and additional experimental sequences. So we have formed a collaboration with our whole body MRI people, and I asked him for a few slides to show you kind of what this would look like, and he gave me this. And this is what it looks like. Doesn't it look spectacular? These have been trimmed in order to fit into the scan, but you actually see from the top of the head, and the gut and the stomach and the lungs and things that perhaps we're not that we're not looking for. But you actually in the final scans you can actually see the upper arms, and you can actually see the legs all the way down to the feet. And so it really is truly sort of whole body MRI. And it used to be that you actually had to scan the head, then scan the chest, then scan the abdomen, then scan the legs, and then do post-processing of the images to kind of sew them together in order to generate an image like this. But now there's new technology that will allow you to just put them in the scanner, and then the table basically does all of the work and collects all of that data for you, which is why the time has reduced. Here is these are all the 5 different regions. And so here is a side view. You can actually manipulate these images in 3D. And I think it will be of particular interest, especially in FSH, to start to look at these, the muscles that are really in the center of the body, not in the arms or in the legs, but also in the neck, and the back, and the shoulder girdle, and the hips. And another potential advantage is that looking at the whole body can help you isolate regions of interest. This is an example of a patient with myositis who underwent whole body MRI. And what you can see is that most of the muscles actually look very good, except for this quadricep muscle here, which looks unexpectedly bright. And so if you can actually get a kind of a fast whole body scan, that will allow you to examine the pictures and then find the regions of interest where you can do a more high resolution study. You're interested in, we were hoping within the next couple of few weeks to months to actually get that section of the study up and running, and we're still actively recruiting new patients, and hopefully what we'll be able to do is to replace a lot of the other anatomical regions that were taking up time in the old protocol with a whole body MRI in the new protocol. So I wanted to invite patients who might be interested in being in the study to contact me. And also, if there are patients out there who have already participated in the study before there was whole body MRI and would want to come back and do this part of the study, that would provide really good longitudinal data for our study and would be extremely helpful. Here are some of the inclusion and exclusion criteria for this study. For people with FSH, they do have to have confirmatory genetic testing, be over the age of 18 and be able to give informed consent. If you have any metal or contraindications to MRI, I can tell you what they are if you contact me. Pregnancy, not that there is any really known, we do MRIs in pregnancy, but at a very high magnet fields, it's the effect on pregnancy has not been clearly established, and so those subjects would be excluded. And what about claustrophobia? I think that a lot of people discover that they have claustrophobia when they get their first MRI scan, and what I would say is if you're anxious thinking about getting an MRI scan, you will be anxious in the MRI scan, and I don't want you to be uncomfortable, and so I do actually ask if there is a history of claustrophobia. I also need controls. This is a special plea for people who could be controls. They are extremely important in any type of scientific study, because as an experimental technique, there is not a lot of data. There aren't thousands and thousands of MR spectroscopy scans on normal individuals. And so what we need to find out is what's normal in this age group. And so I can get a lot of these sort of college undergrads and med students to just kind of to come in, but that doesn't actually reflect our test group as particularly well. And so if you have unaffected relatives kind of in their 40s, 50s, and 60s, that's kind of where my study group is centering now, and they are unaffected and are willing to come and get an MRI scan. I would invite them to come. And so what's difficult is that you have to age match and gender match them. And so what I've been doing is putting all of my potential controls onto a list and then matching them up to the people that are already in the study. So that is the MRI study, and so for kind of my closing out, I did want to make a plug for another research study that we're actively recruiting. We're actually doing this research while we're right now. There has been interest from various pharmaceutical companies in doing clinical trials in FSH. And one of the barriers to actually doing those studies is that it's not exactly clear what the primary outcome measures should be. In other types of muscular dystrophy, we do 6-minute walk tests and things like that. It's not clear that those are going to be appropriate in the FSH population. And so they have really invited us to collect what is sort of natural history, normative data in FSH, and so we are doing that. This is actually a pretty straightforward study, and so what I wanted to point out Carly Matajak, who is our physical therapist. She's going to be collecting data today, and what we're the information we're trying to collect is strength data, first of all, as well as timed function testing. Like how long does it take for you to walk 10 meters? How long does it take for you to climb 4 stairs? And basically using a stopwatch to figure out how long that takes. And collecting that data in a group of patients with FSH would be extremely helpful in establishing our clinical trial preparedness. So I'm kind of down to my last slide, and I again absolutely wanted to express my gratitude to all of our study participants out there. I used to work with a very grumpy professor who used to say, people think that the cures for diseases are going to be a guy going out into the woods and chewing on some bark and getting better. And he's right about that. That is actually not true. The true clinical research is of hundreds of people, thousands of people who volunteer their time and their effort and sometimes their muscle in order to make small incremental discoveries that lead to a larger truth. And so I would be greatly remiss if I did not thank all of our study participants and all of our collaborators at the FSH Society and our Wellstone partners who allow us to do this. And as I promised, my last slide is my contact information.